I'm Dr. Sabrina Siegel with the Neuroscience Education Institute. Welcome to the NEI podcast. On this show, I sit down with renowned mental health care experts from a range of diverse backgrounds to discuss breakthroughs and best practices for treating patients with mental health conditions. In this episode of the NEI podcast, we are discussing Match Day and Psychiatry Residency. This episode is being released in March, very close to the date of the annual Match Day for Psychiatry Residences. And I have here with me today, it is my honor and privilege to welcome Dr. Nat Mulkey. Dr. Mulkey is a psychiatry resident at the University of Vermont and is here to share a very interesting and special experience with the psychiatry residency. Welcome, Dr. Mulkey.
Hi, thank you so much for having me.
My first question for you is, what is it that attracted you to psychiatry as a profession?
Honestly, I've been wanting to go into psychiatry since I was in high school, since I encountered psychology and mental illness and mental health as a topic professionally and academically. So it's been a long time coming for me. I was one of those who came into med school knowing pretty much exactly what I wanted to do and didn't get swayed.
That's excellent. Not everybody has that experience, you know. What was your personal experience with Match Day? Can you share that with us? Because I know this can be a very stressful experience for psychiatry residents.
Oh, yeah. Oh, gosh. It was pretty shrouded in the events of the time. This was the first Match Day after the pandemic. But actually, I remember it quite fondly. We had just gotten a couple vaccines, or at least one dose, and enough to feel like we could have a small gathering of just some very close friends and partners. My med school sent some decorations, stuff like that. And so it was actually a really beautiful memory, despite the year being pretty rough otherwise.
Right. What advice can you offer about how to have the best chance possible of placing with your first choice residency program on Match Day? Because again, I know that this can be a very stressful experience for a lot of people.
Yeah. One thing I would recommend, especially to those who are aiming for psychiatry, is the roadmap to residency that the APA publishes. That has everything from when you start in med school to fourth year. So that's a really good resource. Mm-hmm. And then I would also echo what most advisors end up saying, which is fit is just really important. And what you're looking for, you should really, really feel like the program fits what you're looking for and that you'll fit there. And that can mean so many different things: location, lifestyle, strengths of the program, the specialties it offers, all those things.
And with that being said, what specifically were you looking for? And that kind of ties into my next question, which is, what has your journey been like as a resident in psychiatry at the University of Vermont?
Yeah. What I was looking for, it was really, I've been wanting to go into specifically child and adolescent psychiatry. So a program that had a department that was pretty strong for that. A fast track program was ideal for me, given that I already knew that's the fellowship I was aiming for. I've always been drawn to more rural settings, not a big city person. Those are the things I was looking for.
Okay, so your environment and where the school is located, you think is important as well, right?
It truly is. It was to me. And I think a lot of people, maybe that's not the case. But to me, locations, a community feel was very important to when I was picking my program.
So that takes me to my next question, which is, what has your personal experience been like being transgender? And how has this impacted your professional career track when it comes to perhaps treating patients who are non-binary or transgender? How has this impacted your career path? And why do you think this is so important for clinicians in mental health?
Yeah, it's been incredibly impactful for a long time, like in every aspect of my life and medical training specifically. I came out before third year of med school, which I'd imagine is already a really difficult time. And then
Yes.
meeting many different people, working with different people every single month, new introductions. It was exhausting, but I'd say that was very impactful, difficult, but professionally speaking, it's been, I think, really valuable. Obviously, it's as a patient, which I've been to, having any sort of representation in a field like medicine is really important. There's been many occasions where I think I've been more poised to advocate for this community than others might be because of my personal experience.
Was it challenging personally for you? What was some of that like? Like you said, coming out in medical school and then later, what was that like during residency? Did you deal with some unique challenges? Were people accepting, or was it frustrating and difficult?
It was definitely both. Like I said, third year of med school was a rough time, mainly because I at that point, and still do, identify as non-binary, and every single week, if not multiple times a week, I would need to reintroduce myself and to a new attending, to new residents, to new med students, PA students, and that happened over and over again on every rotation. And at that point, there wasn't a lot of non-binary representation in media or really anywhere else at that point. So it was pretty novel, at least in my small little sphere. So I had many disgusting reactions from like the attendings I was working with directly, residents that I was working with, but also some really beautiful ones, people going out of their way to advocate and use the right pronouns, but also just respect me. And so it definitely added a layer of challenge to third year, but I'm still incredibly proud of myself for not waiting. I think that was some people wondered, well, just wait until you're an attending or something. But so I'm really proud of myself for that, because I think no matter what, all these people will have met one person who is trans, and that will always, no matter what, hopefully make it better for the next person, unless they continue to be discriminatory.
Yeah, your story is very inspirational. And I think that is really amazing. And you should be proud. That takes me to my next question, which is, can you tell us a little bit more about your time at Boston University School of Medicine in Massachusetts, and when you were working closely with faculty on LGBTQI plus curricula in the undergraduate medical education, as well as related initiatives? What sort of sparked that, and how was that involvement like?
It was great. I mean, it was sparked by me seeing some areas where there could be improvements in curriculum, and also being interested in teaching and academic medicine in general. And overall, it was a really great experience. I had some really great mentors at BU who were very mindful about including students in this work and getting their voices. And overall, I had a good experience at BU in this way.
That's excellent. And it's also so inspirational. What a great university. And they are so well known in neuroscience and in medicine. And so I just think it's wonderful that you had that experience, and that faculty were open-minded, and that you were able to make a difference there. It sounds like it's really exciting.
Yeah. I think the start of a difference, hopefully. I'd say medical education in curriculum is a slow moving beast to change, but at least the start.
Yeah, absolutely. What advice do you have for clinicians who want to become more aware of how to treat patients who are non-binary or transgender? I think about the fact that there's so much needed education in this area just as a foundation or a starting point. How can clinicians understand that foundation more to begin with, and then to raise that awareness to be able to treat patients who are maybe dealing with this situation?
I think there's plenty, at this point, there's really good resources that exist in both sort of our professional niche societies tend to have plenty of guides about this stuff now, about LGBTQI plus mental health or other fields. But also, I would say always listening to the community members first, your patients.
Right.
Those are going to be the ones that you defer to. Continuing to keep an open mind. I think a lot of these topics are more fluid than people understand and more nuanced than they understand, and meeting people there without defensiveness is the most important thing to carry forward, is in my opinion.
So having an open mind, refraining from judgment, but also, don't you think awareness is also a good component for the clinician to have? Just to be aware that where the patient might be in this journey, they may or may not need more guidance. Would you say that?
I don't know if they're ever asking or wanting guidance per se.
Okay.
But I think the clinician's role in general should be one that at this point it's being re-examined about what the clinician's role should be with a patient, and less of that of an assessor and more where the clinician is a partner in this exploration. Right. And one that will work with them to provide informed consent about the treatment options.
That makes sense. And I think that is a really important distinction to make when it comes to really defining what the role of the clinician is in general and within this context, I think. So that's great. Is there anything that you would have done differently when it comes to your residency experience or to your match program?
Absolutely not. I'm very happy with how things ended up. It's a weird process, match day, and the whole match process. You end up picturing your life in 10 different ways, but and those are you always, so then a year later you find yourself thinking, I guess what would have happened if I went there? But no matter what, I'm very happy with how things ended up. I wouldn't change a thing.
That's great. Is there any advice that you would like to offer young medical students who are just entering their residency program?
I only laugh because I guess at this point I have been doing it for a few months, but sometimes I feel like that young medical student just entering still.
Right.
But my advice is just that there's actually research on this that it takes 6 months at any job before you start to feel like you have a handle on it. And it's just, I would say almost to the dot, it took 6 months for me to start to feel like more comfortable, like I kind of know what I'm doing. And so my advice is just to, not be shocked if you're not feeling like you know exactly what you're doing for a while. It's just part of the process.
Okay. So go easy on yourself, be gentle on yourself. And what would you say has been the most challenging part of your journey so far as a resident?
I think the most challenging part, it's really just more of the things that are happening outside of residency, and that there was like a very well predicted mental health crisis that was going to occur after the surge of sort of some of the COVID, COVID waves. And that's about right when I started residency, I think, or around then.
Yeah.
I think just confronting starting residency and also such a crisis within my field at the same time, it was challenging, but a learning experience nonetheless.
You were probably part of just so many of the changes that have been implemented within your field that I'm sure it was pretty eye-opening, your experience, and pretty unique compared to other people who've gone through psychiatry residencies at a different time or have started at that time. So that takes me to my last question, which is ending on a positive note. Can you share an accomplishment with us that you're proud of when it comes to your residency? What is one unique experience or something that you could share with us that you are proud of?
When I read this question, I was like, oh, there's definitely some academic accomplishments. I wrote a article on my experience in the ED, and they have some things coming out that I was like, oh, I could share those. But the real one I want to share with you is I learned to snowboard.
Oh, that's excellent.
Taught myself, and honestly, that's my biggest accomplishment recently in the Vermont winter.
Yeah. Yeah, that's wonderful. And that builds confidence and everything as well.
It's incredibly important to well-being to have multiple facets of your life and physical activity. And
yeah, absolutely. You did mention writing some articles, and I have come across some of them excellently written. I would love to share the links to those in our show notes with your permission. And also any of those sorts of resources that you had touched on earlier in this episode, it would be wonderful if we can get those together and share those in our show notes with our audience. So thank you. I just would like to thank you for being on our show. And we are so excited to be able to share these resources with our audience today.
Yeah, thank you so much. Sounds like a good idea. And thank you so much for having me.
Okay. Thank you, Dr. Mulkey.
Thank you. Bye.
Thank you so much for joining us for another episode of the NEI podcast. Please let us know what you'd like to hear more about by leaving a review. Don't miss another episode. Subscribe today.